Hi everyone, this is Ricky Spencer and welcome to the Sociology of Media Voices series for 2022. Today we have the pleasure of meeting Dr. Juntao Lyu, who has just completed his PhD in 2021, a really fascinating area, and it was the negotiating health and migration aspirations for lay health belief among Chinese rural to urban migrant workers in Shanghai and Beijing. His particular research focused on health behaviours and lay health knowledge in different social contexts in urban China, particularly focusing on how Chinese migrants understand and interpret symptoms and health-related life events in everyday life. And they completed their studies at the Sociology of Health and Illness at the University of Leeds in the UK. And currently, Dr. Lyu is working as a professional medical data analyst at Optimum Patient Care in the International Severe Asthma Registry program. And within his role, he focuses on analysing and optimising the management of asthma drug use among patients with severe asthma. That is incredible, Dr. Lyu. Your work is timely because as we're all kind of becoming the norm in terms of living through COVID-19 and its variations which are developing, it's sort of important to understand how people in society see illness and what the dominant medical model has to kind of situate other forms of health knowledge within that space. And today we're going to go through your journey and hopefully we'll be able to learn a little bit more about how we can have health systems and incorporate local traditional ways of knowing for health and medicine and its place in society within the context of the broader medical model. So for all social researchers out there who are exploring whether it be First Nations health and well-being illnesses throughout the world, it will give us an insight into how we can kind of merge the two together and present a worldview. So Dr. Lyu, thank you for coming today and tell us a little bit about your journey. What got you to consider your particular topic?
Yeah, so firstly, thanks for having me. It's my pleasure to be here and to tell about my research and my understandings. I wouldn't say my understanding and my research is like very professional in terms of like a medical perspective, but I would say I just try to provide and try to grab the perspective from sociologists and from our society and from lay people's perspective. So what inspired me of doing my PhD research was based on my personal life experience. My parents as migrant workers in Shanghai, and I observed when I visit my parents, I found lots of my relatives, my parents' friends, they have very different understanding and interpretation of medicine and seeking doctor, and the view of a healthcare system is quite different from my like a very formal and conventional education of how we should see doctors, how they should see medicine, and how we should see healthcare system. Then I kind of had realized that social inequalities and the different social groups, how they play out in people's actual understanding of medicine, of health events, of illness, and that could affect people's health-related behaviors and eventually the health outcomes, and I would say in a broad um, perspective will eventually affect the population health outcomes. So that's what I observed, and I wanted to do more research in this specific area from this specific perspective.
That's fantastic. So let's now break it down a little bit further. So talking about, you mentioned lay health beliefs. So for our audience, can you perhaps define for us, what do you mean by lay health beliefs?
So lay health belief is one of many perspectives from sociology to inspect our health-related lives. So what I would say, although many people have defined what is lay health beliefs, what I would say is lay health belief is how lay people, non-medical professional people view and understand and interpret health and illness happening in their life. So they have this narrative of their own illness events, and these narratives have they attach meaning in these narratives, and they attach their personal feelings and understandings of these events, including specific medicine, specific doctor, and a specific disease happening in their life, and the specific interaction between patients and the doctor. So I think, like in very short summary, lay health belief is just a perspective from a non-professional, I would say, patients or just a person, ordinary person, to understand, interpret specific events they encounter.
And it's quite interesting because there is a current debate at the moment, as you may know, in Australia and throughout the world, about looking at, we're coming out of a space of living with COVID-19 as the normal, and now its variants coming through. Do you think that the experiences of COVID-19 have shaken a lot of people's perspectives about lay knowledge in medicine? Or do you think somehow it's now been re-imaged, or do I say reinterpreted, as a new way of looking forward, taking on, I guess, dominant medical ideas in terms of vaccinations, into how they see what good health is for them?
Yeah, I would say it's definitely a very historical moment when COVID-19 happened, and it's really shaking all over the world people's view of how we value health and how we value our way of life, and I think as I observed, I would say it's also a very good opportunity for people to realize different social groups actually hold very, very different opinions about the disease, about the pandemic, about the vaccination programs. And we have such distributive views regarding all this lockdown measurement and all this public health control policy. So I think this is a very historical moment to reflect how come so many people have so strong different views regarding what we would normally say is good, or it's for like our own good, but still people don't think in that way, or people think in another way, provide a totally different narrative. I think it's very important moment for us to reflect on that people actually could understand and interpret disease, illness, and health in various ways, and this need to be addressed, need to be understood, and need to be focused in terms of to promote or to improve or to solve the public health issues in our societies. Yeah.
It's wonderful. And tell us, Dr. Lyu, your main participants in your PhD, you focused on Chinese rural to urban migrant workers in Shanghai and Beijing. Can you tell us a little bit about that cohort in terms of its characteristics that you found, their worldview when it comes to, as you said, disease and healing?
Yeah, so Chinese rural to migrant workers is currently the main labor force in Chinese manufactories. So after the opening up policy, so lots of Chinese rural population, and they moved to a city and become factory labor force, and but they do not have a very comprehensive social protection. So they have very low income, and they have very relatively worse living conditions comparing with local residents because they are new arrived migrants. And although some of them are quite successful, but majority of them are low income working class people. So this particular cohort, I would say, they bring in lots of traditional Chinese medicine and the traditional way of dealing with illness into our Chinese urban healthcare system, because you know, the gap between rural and urban is quite large. So when they actually live in the city, and they actually have a very different view from what city people would hold when they have to deal with health events, illness events. So yeah, so I would say a very, very important and very significant finding on my thesis is that people are actually prioritizing their health and comparing with other life events and meanings. For example, to making money, to provide their children for education, to build a new house back in the hometown, and to become maybe higher position in the factory, and all these hardworking goals and this life goals, they put them actually ahead of health, and the consideration of health actually become a very luxury thing for many hardworking migrant workers. And because of that, so they tend to view health and illness as a space of negotiation. So negotiation between the affordability of the formal healthcare system and the knowledge they have from their hometown and traditional health healing methods. So when they integrate illness events, for example, when their children or themselves are having a fever, having a high degree fever, they will say, well, sometimes they can just use ginger soup. They can just use maybe some like a traditional Chinese herbs to deal with that. And they think it's probably a better way to deal with this particular like a cold or fever, comparing with going to see the doctor in a big hospital. So when you say that, so firstly, when I heard about this narrative, I saw they actually believe in that, like the traditional Chinese herb, or the ginger tea, or the hot water bath, or the sweating overnight. This kind of method is actually working in terms of healing cold or fever. But when you actually dig in that and to think about the broad context, and then I realized that they actually went to hospital a few times and they found it's very, very time consuming, energy consuming, and very expensive. And also the time of healing, recovering from the cold or fever is the same time when they use Chinese herbs or hot bath or something like that. So they developed the knowledge based on their personal experience. And this personal experience is very like convincing from their views, perspective of view. So visiting a formal doctor, get a formal medicine like Western or modern medicine, and comparing with like a very, very easy and convenient way of purchasing some Chinese herbs and dealing with at home, and they don't need to take time off, they can still make money. And these two ways of dealing with illness actually have like similar or even dealing with at home is better than dealing with in the hospital. And then they develop a very strong belief that Western medicine or modern doctor is not as useful, as practical as I'm dealing with it at home and dealing with the Chinese herbs or hot baths or ginger tea. So in the end, they concluded that this way is better than another way. And although it's just for some like very minor illness, but sometimes when they try to apply the same model, same like a theory to a broad issue, and they could expand that to a broader issue that urban healthcare system is not trustworthy, is profit driven, and is time and energy consuming, while my own way dealing with health problems is more efficient, practical, and useful. And in the end, they concluded this based on their personal experience, and it's quite convincing even for me as a listener. I would say, yeah, it's exactly like that. Yeah. But when you open your app, you could see lots of factors actually get involved in this theory, in this very convincing theory and belief.
Now, for our listeners who are coming to understand health and illness in China, can you tell us a little bit, with your now experience in being in Australia and living in Australia, what the main differences between the health system in Australia? So we're looking at being able to access, services, through the Medicare system, and comparing it to, say, China, what the main differences are.
Yeah, because I didn't spend time researching about Australian healthcare system, and so I don't really have like that kind of expertise
Sure.
or knowledge on that. But what I observed, I would say, I would say it's a very different context in terms of viewing alternative medicine and home therapy in Australia context and in Chinese context. And I do realize that the topic or this perspective cannot be like universal.
Yes.
Yes. So I would say, like when we actually talking about alternative medicine and home therapy, or we actually talk about this, and we do need to realize different social contexts and different social group and how people actually practice it. It could be very different, and the meaning behind all of that also very different. And also I think especially the social inequalities behind all these understandings are also very different. But I would say what I found in common is it's really important to address, to recognize that people actually hold a very different perspective of view to understand and interpret things. And we cannot just overall deny it or overall against it. We need to actually look at it and to understand it and to get the context out and to explain it in terms of better communication and understanding between professional people and ordinary people and public. That's quite important.
So can you tell me, in China, do, say, the migrant workers, when they have to go, well, they make that decision to go into a traditional westernized hospital, do they have to pay, or does the actual state cover that cost?
Yeah, so the out-of-pocket payment for Chinese migrant workers is very different from the local city residents. So for most of them, yeah, because of this difference, so normally they have to pay more than local citizens, yeah, Chinese local urban residents. So that's why they have the difference of affordability, and this could be one of the reasons of developing different perspective or view of medicine and the doctor.
What happens, Dr. Liu, if someone is very sick and they go into a hospital, and they don't have the resource to pay for that service? Does the hospital still take them on as a patient, or is it like, well, if you can't afford the treatment, we cannot look after you, and they have to leave?
I will say both happened.
Okay.
So some people, they do have to leave because they cannot afford the costs, and sometimes some hospital would offer the treatment and then charge them later. And for most of the times, because in China, in what I observed, people always have friends, relatives, so they can ask for. So like my relatives, if they have some serious disease or illness, they go to hospital, the hospital will ask them to contact some relative or friends, can provide the amount of money deposit to make sure this treatment can be continued. So yeah, so it's really depending on the
so that's quite interesting, and I think we have to understand that when we're looking at health and illness in China, we have to understand that underlying health practices is that affordability is a strong factor when it comes to understanding why perhaps migrant workers find it challenging or restrictive to go into a space where they might have to pay a lot of money. And that would really, and now I can see how that understanding that health becomes a secondary focus compared to building of security, whether it be through a home for their family, becomes the priority and health becomes secondary. And I remember you mentioned earlier in a talk we did about, in China, there are hospitals that are designed on the traditional Chinese medicine model. Can you tell us a little bit about that?
Yeah, so that's in like modern Chinese history, when we first introduced the Western medicine, so it's quite a long history, and then we kind of decided to integrate them together. So we have this one combined Chinese and Western medicine hospital in China. So it's specifically, it's providing lots of Chinese herb medicine, traditional Chinese medicine from the hospital. And it is a very, very important and essential part of the healthcare system. And parallel with the formal westernized modern hospitals. And although they also provide lots of westernized medicine in the hospital, but the name and the purpose is to promote traditional Chinese medicine, and also to develop in this area to see if we can actually find out the more useful resources from the traditional Chinese medicine. Yeah.
Interesting. And tell us your journey through your whole thesis. Has it changed your ideas or appreciation of health and illness in China?
Yeah, definitely. It changed a lot. And so firstly, I would say that is, I think that is quite universal. Health is really something, it's like air. When you have it, you do not realize it. And when you actually lost it, and then you realize how valuable it is, that's the thing. And that's very common, like in China, among the Chinese migrant workers as well. So when they are healthy and when they are full of energy and they feel like they can conquer the world, and but when they're actually working too hard and they got lots of delays and they feel like, oh, too much regret on that. Yeah, that's really important. And then I think it's also important to realize what bring people happiness and joy. So for many people, even for Chinese migrant workers, sometimes they are willing to sacrifice because they think sacrificing health can achieve a higher goal, like can make a better children, better education future. And they feel like this is more important regardless healthy or not for themselves. And I think that's quite common as well for many people. For example, if you want to cut off the alcohol or smoking, and some people will say, well, what's the purpose if you can't drink and if you can't smoke? What's the purpose of your life? And then it's also the balance of the happiness, joy, and the health gain. And this is like a kind of a very different way. They could go very opposite way, and sometimes they could go together. But we do have to realize that in terms of promoting health, we need to realize what's the meaning behind health and how people value health. And people do not often always value health as a first priority for majority of people, yeah, because it is something when you have it, you don't realize it. When you lost it, yeah, just for regret, but it's too late, yeah.
And tell us now, Dr. Liu, where do you see your research heading? Are you going to look at applications of your work to look at it further, or are you going into another direction in terms of your research?
Yeah, so I think I would be very interested. Currently, I'm in Australia, so I would be very interested to look at how different Australian social groups developed their very personalized understanding and view of particular health events and healthcare system. And that could be very, I would say, insightful to actually address and find out what's going on and what's not going very well, and to provide the perspective and the potential explanations for things happening in Australia. Yeah, but currently, since I'm just working on medical data analyst, it's purely quantitative, so I haven't got any opportunities on that. Yeah, so I think for my personal career development in the future, I would be very interested to look at that, how the social inequalities, the different social groups, and actually play out in their understanding and interpretation of health and healthcare system and medicine in Australia. I think that could be very, I would say, very interesting and very resourceful research area, and very useful in terms of health promotion and population health as well, since we do need to look into the social inequalities behind all this distribute and all this argument. They are not coming from nowhere. They are coming from somewhere, and we need to understand where they come from.
Yeah, Dr. Liu, I'm really enjoying your the messaging that I'm reading from your work. It's quite clear that you have really touched on this area that many of us from First Nations perspectives in health and illness can thread through, that understanding that a lot of the migrant workers have had instilled with them for many generations. And it's something that comes from lived experience. And we can learn a lot from that. And even in the context of in Australia's health system, where there is a divide between those that access health straight away and those that take longer or are unable to, especially living in remote areas, that we understand to see how we can perhaps integrate both ways of knowing for the betterment of people's health and well-being. And we really do thank your research in providing a step forward to a better understanding. So what we will do, everybody, is we'll below the links, we've created some links that if you wish to contact Dr. Liu about his work, and you're interested perhaps in seeking some consultancy about what Dr. Liu can provide insights into ways of using data for your informed research on health views, it would be your best interest to do so. Thank you so much, Dr. Liu, for coming to speak to us today, and we hope to speak to you soon again about other aspects of your work. And thank you so much for being with us today.
Thank you for having me. Thank you very much.